So as a local Sydney boy, I went to high school at Sydney Grammar. And towards the latter years of high school, I really looked at my career options. From that point, my whole family is into law. So it was really an option to branch out from that. And of all the options that seemed realistic that I'd be good at as a future career, medicine was the one that intrigued me because I knew so little about it. But obviously it was such breadth. Within medicine, at that time, I thought no matter what my strengths and weaknesses are, there would be a career option and a specialty that I could thrive. So GI surgery was what I was exposed to the most, where my mentors were, and then what I kind of, I guess, became more obsessed and dedicated towards. And then, after a good decade of that, you suddenly turn around and realize that, you know a lot about a specialty and therefore are, I guess, in that sense, a specialist. So I'm a general surgeon who's then specialised in upper gastrointestinal surgery and perform also interventional endoscopy. So within the general surgery spectrum, that includes cholecystectomies with gallbladder surgery, as well as the whole gamut of hernia surgery and other emergency surgery and trauma that entails. Within upper GI surgery, that includes malignancies, so operating on cancers of the stomach, the esophagus, as well as the whole gamut of bariatric surgery, as well as anti-reflux surgery and interventional endoscopy. So my training in terms of general surgery initially was quite straightforward. I trained through the St George Hospital network and got through those years in a quite kind of straightforward fashion. After that, I took the opportunity as a fellow to go interstate and abroad. So I had the pleasure of going to the Prince of Wales Hospital in Hong Kong, 1,600 bed hospital, and trained for a year there in terms of advanced upper GI cancer surgery and endoscopy. In terms of my upper GI training within Australia, I trained at the Royal Brisbane and Women's Hospital, which is our largest hospital in the country, as well as Royal North Shore and St George Hospital. Despite being Sydney born and raised, my parents are from Hong Kong, and through language speaking at home and then further studies, I speak both Cantonese and Mandarin. So I'm able to provide consultations in English as well as in those languages. So aside from the stresses of obviously being unwell and needing a surgical procedure or surgical management, navigating through an Australian healthcare system when English is not your first language is quite stressful and at times frustrating. So in terms of that, I've met a number of patients over the years where the ability to understand, converse, and show that level of empathy in their language helps in terms of their health experience and also in terms of the simple things with getting their appointments, getting their operation, and that conversation about the risk and benefits of surgery, which is often quite nuanced and at times unfortunately lost even with official interpreters.